Good evening, ladies and gentlemen, and welcome to another Wednesday night with advisors webinars. On behalf of myself and advisors, I welcome you all. I'd like to welcome my friend, Dr. Mazin Qadir. Good evening. How are you, my dear?
Good evening, Dr. Saadi. It's an honor to be with you, my dear friend, and the rest of the family that attends this amazing series. Thank you.
Thank you. Thank you for joining us from Dubai tonight. Tonight, we are going to speak about one of the most important topics about our health and where it's going to go. And we are not approaching this as physicians or doctors, but rather as project managers and portfolio management professionals and strategic people. And we'd love tonight to benefit from the great and advanced experience of Dubai and UAE government with respect to how they manage their health strategy currently and in the future. And this topic has even gained even more importance due to the escalated pandemic, which we all hope will go away soon, inshallah. So having said that, I welcome you again, Dr. Mazin. I will just introduce you as one of the leaders in this domain, and I will hand you over to speak to tell us a little bit more about yourself, where you come from, and start the presentation. We are all with you for the coming 50 to 60 minutes. Then we'll take, as usual, questions and answers.
Thank you, Dr. Saadi. And again, I want to commend you on your amazing and outstanding efforts, bringing scholars and amazing speakers prior to me, and giving me the opportunity to be in the company of superstars in their industries. And I appreciate under your jurisdiction to hopefully deliver value to your audience and be part of this family as we go through these presentations. So
thank you.
Go ahead.
Thank you and welcome again.
Thank you, Doctor. So basically, Bismillah ar-Rahman ar-Rahim, let me start first by addressing all our wonderful families and audience across the world. Assalamu alaikum wa rahmatullah. Good evening, good morning, good afternoon. I hope you are all very well. I won't say good night yet. I need you to bear with me for another hour before I will say good night. So I was telling Dr. Saadi this morning or earlier this evening about my journey. I came into the UAE 44 years ago. I'm only 42, by the way. My parents came from Sudan. I was born in 1978. At that time, I had a very interesting story. My mother would actually had to travel to Sudan to give birth to me in 1978. And the health system was still very young, hasn't yet built the infrastructure that we are seeing now. My story started with the UAE. In 1978, fast forward now to the two little kids that I have. And how privileged we are to live in a health system that is super advanced in my lifetime. 42 years down the line, I would not trust my wife to go and have kids or deliver our newborn kids in Sudan. No, I will make sure that she has the great services and healthcare capabilities in the Emirates, UAE. So this is a living transformation example of a health system that began when I was born, and 40 years down the line, this health system has transformed itself to become one of the most mature, digitally amazing and outstanding healthcare system in the region and the world. I started my career back in the University of Leeds, where I studied, did my electrical engineer, and I did my PhD in quantum electronics and nanotechnology for infrared imaging and cancer detection. That's how I came into healthcare. So I was an engineer who came into quantum physics by research means I came into healthcare, and I never left healthcare. Healthcare is an amazing industry to work in. They're taking a lot of strides and steps towards transformation. It's a huge industry, very complex as well. I worked in academia for 6 years, and then moved to the private sector for a few years, where I worked in electronic medical records, and then moved on to work with multiple government entities and private sector entities. So my journey took me through a lot of work across the region and across this wonderful region. I came back to the UAE in 2009, where I continued working in the field. At the moment, I work in IQVIA as a director of partnerships and strategic partnerships and bid management. I also advise Dubai Health Authority, where I used to work there for 3.5 years as a senior consultant. So a bit of information about my journey, where I worked in consultancy and the government and whatnot. But I enjoy learning. So I would say that the best, I'm a lifelong student, and I have enjoyed learning and picking up a lot of concepts, and I'm still learning always. The two most important points that I want to bring out here obviously are related to the objectives of the session. As Dr. Saadi is a big advocate of strategic development and implementation, or strategy development and implementation, is a huge advocate and enthusiast of digital transformation. The story of today's content will visit a lot of the strategy development, the strategy implementation, case studies, as well as going into digital transformation in healthcare. So the objectives, if I remember them well, there were 4 objectives of the session. Is first of all, give you an introduction of the healthcare industry. What are some of the features of the healthcare industry? We're going to go into the dependencies and some of the accelerated digital transformation and the requirement for project management, transformation, organizational transformation, and strategy development and implementation skill set in the industry of healthcare. We're going to look at the disruption and the challenges that we have gone through to move from digital transformation to digital acceleration. And finally, we're going to look at some of the best practices that we've seen in healthcare industry to projectify healthcare. So healthcare is becoming a huge pillar and an influencer in the project economy, a big player in the project economy that is coming up in the next many years to come. So with this, I would love to move to the next stage. So the outline, very straightforward. Again, I have like a few slides and hopefully good content for you, ladies and gentlemen, to keep and learn. And those who have been foreign to healthcare today, you can get some induction on the healthcare system and the complexity of such a multifaceted industry. Let me start with an introduction. The first thing is basically, let's start with leadership. Everything, and as you know, in project management, if there is no leadership buy-in, most probably you won't get success. So leadership buy-in is always number one step in any successful project, process improvement, or any sort of transformation that will take place. And that's why we start with our leadership in the UAE specifically, where the objective is very straightforward. The vision is to have the best services in healthcare and education to the nation or the population within the UAE, not in 20 years, now. Number one is basically the ultimate objective. So in this, I would love to start with His Highness Sheikh Mohammed bin Rashid, Vice President of the UAE and ruler of the Emirate of Dubai, and Prime Minister. He has a clear vision, and it was actually put forward in his 50-year charter that was published almost a year or 2 years ago, where again, to attain the first place, it's very important to innovate. Innovation is the number one objective of resilience, survivability, and sustainability. So one of the articles in the chapter, and the chapter had a few articles actually, is to actually disrupt healthcare, doctor for every citizen. So His Highness has been showing us the vision, or showing us the way forward, not knowing that in 2020 we will be so prepared for a pandemic that has come to us at our doorsteps. And thanks to the founder of the United Arab Emirates, the late father, His Highness Sheikh Zayed, and all the rulers of the UAE who have picked up the efforts and building the infrastructure in preparation for such a critical moment in our lifetime. So again, I would love you to go into, if you just type in this in Google, there's a wonderful video about obviously the strategic objectives of leadership for the next 50 years, where healthcare as an integral industry of the presence and the existence of this nation and the nations around us would be disrupted and transformed as well. It's a continuous journey of transformation. And I think maybe this is one area that I would like us to start with by opening the discussion with a poll for our wonderful audience, Dr. Saadi. Poll number 1, if that's okay. And I would like to invite the audience to go onto their polls function and answer poll number 1. I wanna see. We have been going through a revolutionary period of time, right? So it has been an amazing 9 months, and these 9 months we have been tested and we have been found to be resilient. Our love and blessings go to all the front line defenders who have been fighting the pandemic for the last 8 months, healthcare professionals, leaders, industry workers from all over the industries, whoever has been working in the supply chain, who made sure that food is there for us to attain, pharmacy owners, supermarket workers. They have been tested and they have delivered in a very critical time. Our love and blessings go to them, and in you we trust, and specifically in our leadership who has guided us through difficult times. But looking at the poll, I am very happy to see that 71% of the audience has felt that this new normal has pushed digitization to the absolute limit. I won't call it the limit. It's the new dimensions, the new space where digitization and digital transformation has been perhaps accelerated to an area, to a new paradigm. It has extended our understanding of digitization, and it has pointed us to the important need and the critical need of digital infrastructure. So if I take some of the feedback that we have from this poll, the UAE Healthcare, as I told you, was the focus of our leadership, and still is the focus of our leadership, to try and build the infrastructure, to try and build resilience within it, to try and make sure that sustainability and survivability is there. His Highness, out of his 9 articles in the 50-year charter, he chose article number 5 to disrupt healthcare. And this happened a couple of years ago. Imagine. This was his vision before the pandemic hit us. And because of the great efforts by his leadership and the people who have been delivering and working for so many years, implementing infrastructure, putting together strategies and working on them, transforming and installing the important pillars from which we relied on during the last 10 months to survive has definitely shown their mettle. So, and I wanna focus on some of the thought leadership that has been coming out specifically when it comes to healthcare. If you look at some of the great content that has been coming specifically out of the Dubai Health Authority and many leaders and visionaries within the Dubai Health Authority to try and push the envelope. So, for example, healthcare. How could you actually push the envelope with all the transformation and the required tools, and perhaps look at the latest and greatest trends to push the envelope with. So if you look at some of the great aspects, for example, the concepts of technology, and you'll see a lot of projects at the moment happening in this area, genome and the advent of inventions in genomics. AI and data science is a huge, important aspect. Human capability, education and research, the importance of education research, building accountability and building resilience within the platform, within all the platforms that we have in healthcare, and then the power of pharma and whatever pharmaceutical companies have been investing in research and data and whatnot. And this is a huge power, So what I wanna maybe ask is, which one do you think, and later on there will be a question about which one do you think will come handy in healthcare. I want you to also think out of the box, because this is what healthcare is trying to do, is push the envelope. Some of the areas that the Dubai Health Authority has been strategizing upon and yet to be obviously published and discussed is what are some of the areas that we can push the envelope with. So, for example, there is a lot of discussions on space medicine. Recently, UAE was the first Middle Eastern nation or first Arabic nation that has launched a space mission into Mars. So now we're trying to push the envelope with space medicine. What are the next inventions and discoveries in Human 2.0? What are some of the areas that we need to look at? The future health experience. And these are great areas that the healthcare system is going through. Again, trying to push the envelope. And I would love to invite the audience to think outside the box in healthcare. So future health experience, what should we focus on? How can we reinvent the patient experience? How can we reinvent the model of care? How do we reinvent the roles and responsibilities of all the stakeholders in healthcare? What are the most important pieces in healthcare when it comes to lifestyle? You've been experiencing the 30 by 30 challenge by His Highness Sheikh Hamdan bin Mohammed, who's been taking us through a wellness journey every year to try and emphasize the importance of wellness, physical activity, mental health, number one, community sense, and roles and responsibilities of our healthcare professionals in guiding us through this. Another area, the advent of stem cells, genome mapping, precision medicine, cellular biology, and how we can actually go into using technology to help us maneuver the art and the science of genomes and genomics. How do we look at the sense of pain? How do we try to reinvent ourselves in looking at vaccines, diagnostics? And this is what has been in the minds of our healthcare leaders in the UAE and across the region. What are the tools and the technologies that we need to focus on? Human 2.0, what is the role of robotics, bionics, and AI, looking at nanotechnology? When I did quantum electronics back in the days, 2000 to 2005, we were looking at infrared imaging that uses nanotechnology, based on nanotechnology that could actually isolate your cells by exposing you just to a camera, no radiation in it. What's the role of smart wearables, and so on and so forth. Space labs and the concept of space medicine, and how does that impact mental health? Again, we are very accustomed to a lot of Hollywood movies that talks about space missions and the importance of mental health. Moving on into the importance of economics within healthcare, the concepts of biostatisticians, data scientists, health economists, again, very important aspects as healthcare expenditure is coming out of control or is going out of control. So let's look at some of the areas that healthcare has been looked at specifically from the vision of the UAE, and that's the 2021 vision that has been guiding us for the last many years to try and bring us to the most important pillars that we should set our strategies towards, from a unified in knowledge, responsibility, destiny, and prosperity. Again, these are basic strategy concepts that build the community and build our nation towards a unique vision. The role of healthcare in achieving this vision is very centralized. You cannot build a nation without putting your bet on healthcare and education. So this is a very important aspect of the UAE vision that looks at, for example, ensuring the population wellness, looking at offering world-class services, building infrastructure that is resilient and sustainable, raising awareness. Again, and pandemic is a true testing environment for the concepts and the pillars and the initiatives that this vision has come up with. And if you look at the importance again, and this population mix is looking at the increase in population as we are going through the many years, and the different mix of diversities that has come to this wonderful country, and how to deal with them and how to deal with their healthcare needs. Again, it's a very important aspect, and I'd love you to go into the Dubai Health Investment Guidebook that has been published last year with amazing information that actually will guide you through those key facts. Also, I would love you to visit the Dubai Health Strategy 2021, which is available online as well, that shows you some of the great initiatives that has been put forward for us to be guided when we are implementing these initiatives. The UAE, as you know, has a huge amount of healthcare infrastructure investment, and this is very apparent in the state-of-the-art 126 hospitals across the whole nation. And obviously these numbers are projected at, I think, 2017 or 18, according to the sources that I've actually used. But the most important part is the growing number of hospitals to cater for the growing number of populations. And I'm talking about hospitals and clinics at the same time. It's a humongous amount of infrastructure that has been built to cater for the healthcare system. Again, just giving you a scan of the landscape of healthcare in the UAE that has been pushing towards a humongous investment and strategic focus on healthcare. So if you look at the Emirate of Dubai, now the actual number of hospitals total is around 38 hospitals or 34 hospitals, if they say 38, that caters for 2.1 million, which is now around 3.8 million, if I'm not wrong, or 3.5 million. The number of beds have been increasing to cater for such a growing population. It's very important to cater for your health system by showing the expenditure in healthcare. Healthcare expenditure has grown in the last, let's say, 15 years to reach high levels of healthcare expenditure per capita. And the idea is, as the expenditure in healthcare grows, healthcare demands also continue to grow, and population is growing. However, it's very important to keep this in mind as we understand the needs in healthcare and how we can optimize cost, because this is another session, let's say, health finance and healthcare expenditure, but trying to understand how healthcare is managed from a dollar sign or a dirham sign, let's say. If I look at also the healthcare stakeholders that we have in the UAE, from the segmentation that you can see in front of you, we can segment healthcare into 3 layers, from regulators to providers to payers. And then there is the government and the private sector. And it's very important to understand the landscape, because those are important direct stakeholders. Obviously, there are indirectly impacted stakeholders as well, that you can see them joining the stakeholder map here. So, for example, we have aviation, airlines getting into healthcare. We have obviously investment funds and investment hubs coming into healthcare, and so on and so forth. But it's very important to understand the big players in healthcare and how to cater for that. The 4 major regulators in healthcare, from the UAE Federal Ministry of Health and Prevention, to Abu Dhabi Department of Health, to Dubai Health Authority, and Dubai Healthcare City Authority, that actually work together to regulate the healthcare system in the UAE. It's a mundane job. It's not an easy job, trying to actually work with the different healthcare providers, public and private, try to regulate, try to put the governance structure, put the policies. And by the way, the pandemic has taught us a lot of lessons, specifically in the regulation area. The concept of hyper-regulation. You've seen a lot of the technology trends talk about hyper-automation. And in healthcare are trying to make sure that they're a step ahead, specifically with the technological advancement that happened in the last 8 or 9 years with the digital acceleration. Again, it's a very interesting concept as we work with the different healthcare providers. I want to also show you the 6 forces that are shaping healthcare. And the 7th one that you don't see is basically public health, which is now is becoming an important necessity and priority. The concepts of pandemics and outbreaks, and how to track and trace your cases, very important. The data infrastructure that has been in play for the last 9 months has shown the resilience of the health system in Dubai and the UAE. Demographics is a big player in the population mix that we have, the different diversity and the different nationalities. The importance of reinventing patient experience and making sure that the patient is empowered. They talk about the smart citizen. There's a Harvard talk now, a webinar this morning that talked about the concept of smart citizens, empowering your citizens by allowing them, enabling them through smart and digital means. The growing private sector and the importance of the private sector to collaborate with. And you've heard a lot about the PPP, the private-public partnerships. And this is an important aspect as we get into the post-pandemic era. Medical tourism and the reinvention of aviation as we go into the new normal, and how travel for medicine would be reinvented. How do you bring in healthcare and offer services wherever you are? Doesn't matter where you are, you have a digital infrastructure that enables you to access doctors, nurses, and you can see the importance of telemedicine in the last 9 months, where telehealth and telemedicine and virtual consultations has become a norm now. And then finally, the importance of wellness for your mental health. Again, these are key players in the healthcare system that enables us to drive healthcare disruption and innovation in the UAE. But the most important part are looking at the snapshot. What are the 6 major concerns and perhaps areas of interest that the UAE health system needs to look after, from chronic diseases to fertility rates, to childhood communicable diseases, to mandatory health insurance, fatality causes specifically related to road traffic accidents, RTAs, they call it obesity rate, and the concept of wellness. It's very important to understand how do you challenge or how do you cater for these major issues. Don't forget, now with the pandemic, now you make sure that you have what we call surveillance capabilities for disease control, for outbreak management and whatnot. And these are important concepts in healthcare that is shaping the healthcare system in the UAE. So, I mean, the challenge is specifically from a regulator point of view. Any health system has these major challenges. However, let's look at the UAE specifically and look at what are some of the major concepts that we need to focus on. Workforce shortages is a big systematic issue that we have across healthcare. At the moment, our healthcare workforce is at the forefront defending us and helping us through awareness, through guidance, through making sure that we fight all the rumors and negative news that we get by making sure that we have a single source of truth, a lot of guidance, a lot of awareness are offered to the public, not only to prevent and to preempt cases, but also to try and reduce the pressure on the hospital and obviously the hospital infrastructure in the UAE. A fragmented health system, which is an important challenge that has been tackled across the region, from the UAE to Saudi Arabia, by building the digital infrastructure to connect hospitals. A lot of that is now coming out. You will hear things about health information exchange. You will hear a lot of things about dashboards and analytics and national claims platforms coming across the region, from the UAE to Saudi to Oman to Jordan to Egypt. And this is very important. Seeing the importance of this, Abu Dhabi and Dubai has been leading the way in a lot of the work, the infrastructure work that has happened in these concepts, in this area, to defragment the health system and pull them together. Growing population, pressing health issues, insufficient capacity, either beds or resources, or making sure supply chain is another important aspect in healthcare as well. So these are some of the challenges that you will see coming around to all the health systems that we have been exposed to. And the balance is always there. So access to healthcare services, quality and safety of the healthcare services, value, affordability from from an affordability point of view, and the importance of centricity, so patient or citizen-centric or workforce focus, because at the moment we have a fifth element, which we have seen now, the workforce burnout or workforce safety. Our physicians, nurses, doctors, lab technicians, front staff, registration staff, admin staff, who have been managing our healthcare infrastructure. And this is an important element that comes into the equation. How do we safeguard them? So before I go into the strategy, I would love to actually shoot the second poll now, because I want you, whether you come from construction or aviation, I want to see what are some of your thoughts in terms of after the pandemic, or during the, after the first 9 months, which industry has exhibited resilience and you think will bounce back in 2021, especially the hard-hit industries such as retail, aviation, and whatnot. I want to know your thoughts from your experiences and your knowledge. Which industries do you think will pick up, work on their core values, core services, and pick up in 2021 as we get more and more comfortable with handling pandemics? Okay, very good. I can see a spread of interest from construction, which is again a very interesting. Construction and healthcare is the top. Okay, fair enough. Absolutely. I think that's a good sign that definitely there's always a need for expansion and construction, and obviously healthcare. Hospitality, I think hospitality is showing very healthy signs in Q3, Q4 of this year, and hopefully with the advent of wellness and bringing wellness into hospitality, it will definitely pick up. Aviation, they are reinventing themselves. Logistics, very interesting. Logistics have been one of the most important pillars of survivability during the pandemic. So the concepts of logistics, shipping, moving containers and goods, and bringing supply chain. Again, logistics is a huge industry. Perhaps it might have been emphasized during this last 10 months. Transportation, very okay, most less likely. Retail, interesting, and food and beverage. Food and beverage, by the way, is specifically, it seems that they have been coping with the pandemic due to the need. So you can. There was a saying by one of the leaders in previous conferences. You can never stop your reliance on food and healthcare. Those are the two major concepts, right? Food, healthcare, and some people will add education. And I apologize if I didn't put your industry there, education, because again, it's a very interesting industry that has been added to the mix. So thank you for that. I really appreciate it. So the top are healthcare and construction. That's really, really good. Excellent. So let me take you to Dubai Health Strategy 2021. And this has been set since 2016 and built upon to try and prepare us for days and months like what we've seen in 2020. So what I like to do is show you the cascading of strategy. So from a national federal strategy to an emirate strategy, emirate plan, and then it cascades down to an industry. So nation, state, industry. And then within the industry, there are always specialized strategies. And I want to mention this because the concept of strategy development it's an amazing concept. And Dr. Saadi will agree with me, because strategy design and development sometimes are not connected with strategy implementation. And this is the true role of project management and transformation and change management, is bringing closely the strategy design and development to strategy with the implementation and operationalization of strategy initiatives. And again, this is very important, the connectivity and the cascading, how you link a nation federal vision to a industry vision through this through the different cascading layers. So what I want to share with you, first of all, give you an understanding of the health sector in Dubai, where you have, the public sector, which is resembled in three regulators, two main regulators, and a number of hospitals, around 34 to 38 hospitals in the Emirate of Dubai, over 1,500 clinics. This has been growing over the many years. As you see, the patient volume has been growing in the clinics and the outpatient visits, as well as in the inpatient visits. But also, I want to show you the importance of building the infrastructure to cater for a growing population. And this is very important, as the two major concepts of regulating and operating becomes the main driver of your healthcare excellence. You separate your regulator from your operator to try and drive efficiency in your healthcare system. If you can see in the middle of the slide, DHA as a regulator sets the direction, puts the regulation, puts the structure of policies. And in the last restructure that the DHA has gone through, Dubai Health Authority back in 2018, they've spun off the operational arms from Dubai Healthcare Corporation, which runs the hospitals that belong to Dubai Health Authority, and the primary healthcare centers and the medical fitness clinics and whatnot, and also the spinning off a corporation to regulate and manage the insurance companies. Very interesting, way of governing healthcare system, which is has been studied and analyzed to try and drive the healthcare services. Dubai Healthcare City Authority, which is the one on the right-hand side, has been always a regulator for the free zone healthcare system and has been encouraging and working with the private sector to drive the healthcare services within the free zone. Meanwhile, the Ministry of Health and Prevention, as a federal umbrella and a federal entity covering the whole UAE, has been there to oversee the direction of the nation, with collaborating with obviously Abu Dhabi Department of Health. And the importance of the private sector is evident. In this slide, you can see how important the private sector reliance is. So as we drive most of the healthcare services in the Emirate of Dubai through the private sector, hence emphasizing the importance of partnerships and collaboration. So innovation is always driven through collaboration. And that's why, so you will see, for example, out of 37 slides, hospitals that we have in Dubai, 31 of them are actually to belong to the private sector. This specific data set is coming out of the Dubai Health Investment Guidebook or Guide, which is again available online. In DHA website itself, there is an open data website. I'd love you to go and read about it. There's a lot of great statistical information, 300 pages almost, our Dubai Health Statistical Book, that has been a great document to look at the different stats within the healthcare system in Dubai. We have the Dubai Health Investment Guidebook or Guide that was also masterminded by the investment department in Dubai Health Authority. And there is also the Dubai Health Strategy 2021. So I've given you 3 references to actually go and read about the Dubai health system and to see strategically how Dubai health system is driving through the different aspects of innovation. So just to give you an understanding, private versus public, almost in 2017, 79% of the visits to the clinics are happening at the private sector, and only 21% is happening in the public sector. Meanwhile, the inpatient visits to the hospitals, almost 74% takes place at the private sector. Again, this is just an understanding of the different stats of how the health system looks like in Dubai itself. And what I want to take you through is to give you an understanding of what are the different important aspects to build a Dubai health system by looking at obviously the Dubai in its geographical position as a hub and a center of innovation, also the infrastructure that has been built into Dubai to cater for world-class services, the strategies and the initiatives that has been coming out in the disease prevention and promotion, looking at innovation and how to enhance that and increase the attraction of that, implementation of standardization and improvements of medical services across the board in healthcare. Measures, how do we measure excellence? Looking at the quality of medical insurance, and then making sure that we utilize all the different advancements in the other industries to work with healthcare in Dubai to collaborate. This is the vision and mission of our Dubai Health Strategy 2021, which looks at a very simple concept. The leadership vision is healthier and happier community. How do we achieve that, and what is the journey that we will take to get to that vision? Is 3 major words: fostering innovation, integrating our different services and care models, and enhancing community engagement. This is what the essence of healthcare transformation in Dubai means. The 3 goals that you can see in front of you look at the way we reinvent governance, compliance, and accountability, and to try and enhance and boost that, looking at improving population health and the importance of managing health from a population perspective using dashboards and technologies, and then inventing the service model or what is the service model for healthcare. This is supported by 6 strategic objectives, 15 strategic programs, and over 100 strategic initiatives when it started in 2016. And a very great, ambitious, and well-studied started that strategy. The strategy itself covers multiple different programs, and you can see this is just a sample of the 15 programs that the strategy covers, from innovation to primary dental care, which is very specialized, to mental health, which is an important aspect. And imagine, like, for example, each one has a strategy of its own. Mental health is a strategy that was launched a while back. Dental health is also another strategy that would have subcomponents within it, medical tourism, and so on and so forth. Another important aspect is the advent of informatics and technology. So investment and the partnerships with the private sector, with the technology vendors, with the different players in healthcare who can come together to drive innovation. So what I wanted to do also to show you a couple of case studies. The first case study is obviously what we call is the Dubai Health Facilities Performance Framework. And I want to quickly jump into a poll before our third poll, because I want to show you, I want to ask your opinion to see what technology do you think healthcare should focus on? And you can choose multiple choice here. What do you think should we focus on? And I've given you a series of technologies that I've seen in the publications that came out of Deloitte or Gardner when it comes to the 2021 technology trends. Obviously, big data has always been the focus of many industries, specifically healthcare. AI, absolutely, specifically in this era of post-COVID or pandemic era, which is the new normal. What else? What should...
one thing, sorry, Dr. Mazin, they can only select one, unfortunately. The platform is not allowed to more. One thing. The other thing, if you like, very, very quickly, maybe most of us know, for example, what AI is and so on. But if you can explain, like, in 2 words about what is, for example, hyper automation, VR, AR, quantum, and so on. Thank you.
Sure, absolutely. So the concept of hyper automation is the child product of RPA, where you actually take a robotic process automation, RPA, and basically look at all the manual processes and try to automate this process. Hyper automation is taking that speed to a higher and a quicker speed. So that's the next level of RPA, robotic process automation. Quantum technology is a technology that has been coming for the last 25 years. It's based on quantum physics. The father of quantum physics is a gentleman by I forgot his name is pronounced Schwarzenegger or Schwarz. He's the father of quantum physics, and he has a very interesting equation where he takes classical physics and takes and proves to you classical physics is when you throw a ping pong ball or a tennis ball to the wall and it bounces back. What quantum physics tells you, it's the duality of wave-particle-like behaviors, where you actually, instead of throwing the ball to the wall and it bouncing back to you, that's classical. It actually penetrates the wall into a wave-like behavior, and it comes out of the wall. So quantum physics is a interesting concept that has been proven, by the way, in the technologies that are built on it, and it's related to the semiconductor industry, manufacturing industry, where you build your materials so small. We're talking about angstroms. Angstroms is a 10 to the minus 10 of a meter, and it exhibits behaviors that are unnormal, and hence the idea of quantum electronics. So based on these behaviors, now you can build cameras that could actually detect infrared waves. You can actually build computers that could actually have dual states. So instead of 1 and 0, like the normal computer, quantum computing is based on having both states at the same time. Again, very interesting science. It's a huge science that literally mirrors classical physics, and it's based on I will have to get you the name of the scientist who came up, actually multiple scientists. The wave and particle duality was founded by a scientist that I don't recall the name. But it's a branch of modern physics that looks at the energy, the movement of electrons within the atom. It looks at the particles and the behaviors of the particles. A very, very interesting concept. And based on that, there's obviously a whole new set of applications from quantum electronics to quantum optoelectronics, which is the optics, the technologies that are related to optics, quantum computing. There is a whole new branch of technologies that will come out. The other concept that I'm looking at as well, let me just show you obviously everybody is familiar with blockchain and the decentralized or the ledger, the immutable ledger. The Internet of Behaviors, that's an interesting concept. And basically, Internet of Behaviors is the next level of Internet of Things, where now you are bringing in mental health into it, right? So it's your Internet of Things, so your devices and whatnot, but behaviors that actually look at human mental status, human let's say spiritual side from a behavioral side, right? And looking at bringing in psychology and psychiatry into this. Again, edge computing is a very interesting concept. It looks at the different one of the fastest concepts in advancing computing. It looks at faster response. Is a distributed computing paradigm that brings computation and data storage closer to the location where it is needed. Again, very interesting concepts. A lot of people actually, a lot of the publications that are coming out of Gartner talks about it. So again, there's a lot happening. We are in a very privileged time at the moment because of this great, but artificial intelligence by far wins the bet. Yes, AI is definitely an important concept, and it's actually coming into the governance by seeing the Ministry of AI or the Council of AI. You'll see a lot of the University of AIs. So artificial intelligence is definitely being embedded within the DNA of our society, educational system, as well as in the governance of our system. So the first, as I told you, the first case study that I want to take you through is what we call the Qiyas project, the Dubai Health Facilities Performance Framework. It's a dashboard of KPIs, basically. And the idea is to try and bring in performance monitoring into healthcare. Healthcare in the world is going through a huge transformation, into a huge shift from volume to value, from quantity to quality. And this shift indicates the need for a measurement way. So if you have done, for example, balanced scorecards, it's the right skill set that you need to pick up as you come into healthcare, because it's all about KPIs, operational key indicators. It talks about health checks and key performance indicators. So again, it's the right level of performance management. Is a huge skill set that is required at the moment, specifically in healthcare. And the idea of actually building a platform where you can actually bring transparency, you can manage performance, and you can see how healthcare is now being transformed into a quality-driven and outcome-based industry. And this is, again, this platform was one of the visions and initiatives that has come through the strategy itself. And the idea is to actually agree on a number of categories to start measuring. So the categories could be agreed upon, and based on the benchmark, these are the top 5 categories that we've seen across the world, from patient happiness to patient safety, clinical quality, operational measures, and financial measures. Again, this is a benchmark study that has happened across, looking at Saudi Arabia in the region and how they build their quality dashboards and measurement platforms, looking at the US, which is very measurement driven. The US is so focused on quality measurements, and they've created a concept, they call it the meaningful measures. So they've taken that even to the next level, because they had so much measures that the physicians and the clinicians used to adhere to. They have 3 levels of measurements in the US that they've been working on, which is again a big problem. The burnout rate in the US health system is humongous. It's the second biggest problem after, before COVID-19, it was the second biggest problem after addictive medication, for example. People can measure your healthcare organization without overburdening your physicians and clinicians. You will hear me saying this quite a lot. The guiding principle for such a framework is very simple. You divide your hospitals and your facilities in the healthcare system into 3 players based on their maturity, digital maturity, and performance management maturity. Do they manage and monitor their performance or not? Innovative means that they have implemented their long-term reporting. They have very clear strategic outcomes. They have very great. They measure the health impact. Developing, so those are in the middle. So they are not as early adopters as innovative, but they are trying to operate with intermediate reporting. And then early, those hospitals or organizations that are still building their capability and they're still identify their accountability. And based on that, you use a scientific development methodology and innovation, as well as technology infrastructure, don't forget, because you want to remove biasness when you collect those measurements. The most important success factor in your KPI dashboard is how much human interaction do you have with those KPIs as you collect them. Very interesting concept. The next one is basically to look at the maturity framework that you will put from a digital perspective. So from a holistic perspective, including digital. So if you look at your hospitals, do you think they are ready? Or are they maturing, or they are not ready? And you actually base your assessment on 3 layers. Number 1, you base it on the digital infrastructure that they have. Do they have an electronic medical record or a hospital information system? That's what those letters mean. Do they have any of the measurement categories? Do they measure those categories, or do they have gaps in the measurement of these categories? And then how engaged are they? How do they engage their workforce? Do they have policies? Do you have procedures? What are processes that are in place to try and look at their measurement and technology framework that is used for measuring? Again, a very interesting case study and an important project, because it shows how the ecosystem of your healthcare infrastructure would look like. As you have private sector hospitals and government sector hospitals, you understand that your government sector hospitals are all connected within one electronic medical record system. And this electronic medical record system connects all the hospitals under DHA. But in the private sector, you have very siloed electronic medical systems. How do you actually, on top of that, you also have a national claims platform that is running in Dubai at the moment. Plus, you are also putting what we call the DRG. It's a reimbursement model or system that is being implemented in Dubai now. And this is for the billing and the reimbursement of hospitals for all the services that they provide. Because the healthcare system, how do they get paid? The patients come in, you have to have an insurance in Dubai. You will not you will not get a visa if you don't have an insurance coverage. So anytime you go to a hospital or a clinic to take a service or consume a service, your insurance will cover for that. And once you finish your service or complete the service, the journey in the hospital or the clinic, you then get the clinic or the hospital generates a bill, and this bill goes to the insurance company for obviously processing and whatnot. And if it's approved, then the insurance company will pay the hospital. Where does the insurance company get their money? The insurance company get the money from the employers. So at the end of the day, the employer pays the insurance company covers the patients go to the hospitals get paid by the insurance company. This is a money cycle in healthcare. It's very important that you understand that concept. But the most important part is when you have such a huge system, you're not only gonna connect the systems together through what we call the health information exchange or the health information interoperability. And this is a huge project that is happening as we speak in Dubai, connecting all the hospitals electronically. But you will put on top of that also a dashboard, what we call a performance framework, to actually monitor all the separate systems and the healthcare providers to try and measure the quality. And again, it's an important aspect of any health system that you in order to monitor the performance. So again, the framework is very simple. Acquire, get the data from different sources, analyze the data, and it's very important skills set that you require when you build projects like this. And then the last one, which is, let me just remove my photo, you act upon it, you consume it, you actually visualize it. So you can see data is at the heart of this project. Data is at the heart of all our projects in healthcare systems, in healthcare technology and digital health specifically. So the idea is you have 60 million claims that gets processed in Dubai. You have over 978 healthcare facilities. They have been ranked or being ranked. Measurements, there are 81 measurements, KPIs spread across 5 main pillars. And finally, you have 7 dashboards to display data and facility results. Again, this is just an example of a case study that we've looked at that is being developed at the moment in the Dubai health system. And the idea is to expand the outcome reporting, perhaps enable predictability and predictive modeling and AI, as well as look at consumer reporting and reimbursement planning. The Dubai system consumes over 18 billion dirham a year. That's how much expenditure is happening in Dubai health system. You can divide that 20% cash out of pocket, 40% is private sector, actually more than that perhaps, 40% or 50% is claims processed in private sector, claims processed in the across the system, and then a government budget of around 20 to 30%. So again, this is how the 18 or 19 billion dirham that gets distributed in the health system. And there is monitoring. They monitor the expenditure in Dubai Health Authority across the whole health system. It's very important because the health economics is very important. Another important case study that I want to share with you is the medical education and research strategy that was put together by the Dubai Health Authority, and the importance of bringing all the big stakeholders to work together to enable, to actually build competency. One of the biggest gaps in any health system is competent healthcare professionals, competent workforce. Not enough. They are competent. Every clinician needs not to only learn the medical education, but also get very acquainted with digital solutions and digital concepts, get more educated about health economics and the financial aspect of healthcare. Again, a lot of skill sets that now clinicians need to pick up. So the big confusion. The most important thing about the medical education strategy is to build the governance that will facilitate an integrated academic health system. This is very important for innovation. Building upon workforce planning, residency. And again, one of the biggest challenges that we've been exposed to in the pandemic is the fragile workforce fabric that we have across all healthcare systems. Not enough physicians or nurses. If they are enough, they are overworked and burnout. The mental health of our workforce, the exposure of the workforce, exposure of the health of the workforce. Again, medical education is very important. Some of the initiatives that came out of the strategy is to look at digital and the use of VR, AR, for example, in accelerating the medical education of our future physicians and clinicians, looking at collaboration, looking at different ways of investing in medical education, and so on and so forth. Again, very high concept. A third case study that I prepared today, obviously, the importance of innovation in AI. The strategy of innovation in AI within Dubai Health Authority was launched 3 years ago. And the idea came because of the trends that are happening. Many years ago, we have started the first AI ministry in the world, and this was a pandemic. This was an epidemic step in the recognition of the importance of artificial intelligence. At the moment, it's one of the most important aspects of the digital acceleration that is happening. And this is why it's important to understand the innovation framework that has been proposed within Dubai Health Authority. Again, it's a lot of it that looks at competency. So remember what Project Management Institute has been talking about recently. It's about talking about the workforce of the future. Citizen coding and citizen development programming. We're talking about the concepts of digital maturity of your workforce. And this is the essence and the requirements of healthcare transformation, is how you can actually look at the culture, the governance, try to bring in design thinking. You need to start thinking about collaborative frameworks of how to work in teams, agile teams, the concepts of agile teams. Again, it's an important aspect that builds the innovation framework of Dubai Health Authority. Looks at competency, looks at skill set, looks at relating it to the other important aspects and pillars of healthcare, from public health all the way to patient safety and whatnot. Again, very important aspects. So, and I want to bring in maybe our fourth poll at the moment, just as I get into the last section of my presentation. Our fourth poll, as you've heard me talking about different stakeholders, what are most impacted healthcare stakeholders in the new normal digital era? I want you to select from your, what you've heard, from your experience, what you've read, who are the biggest influence or impacted stakeholders in healthcare with the new normal, the digital era. Let me give you a minute. The options that I've shared with you in the answers starts with patients, because again, the biggest player in healthcare is patients. You can call them clients and citizens, right? Regulators, your government entities, insurance companies, the payers, pharma and life sciences, again, very important player, especially in the last 10 months, as they are preparing for vaccination. That's important. Academia and research. How are we working with our technology partners? Excellent. And thank you for making patients number one impacted. The empowerment of your citizens and residents by making them smart has revolutionized healthcare. And absolutely, I completely agree. His Highness a few years ago said, I want all the government services to come to be at your fingertips, Sheikh Mohammed bin Rashid. And he is a visionary. He has seen how industries should be disrupted. Industries like aviation has been running towards that direction. Hospitality has been running into that. Entertainment has been running towards that. And now healthcare is been lagging behind, but it's catching up, because now the emphasis, because of this pandemic, has been placed on healthcare. And that's why my next few slides shows that healthcare 2.0 is where we are. In the fourth industrial revolution, we are yet to go into health 2.0. So patients is at the center of health 2.0. Healthcare can learn from other industries like retail, like banking, like hospitality, even biotech, by the way. The most important thing in healthcare is four things. And by the way, I want you to remember this statement: the quadruple aim: better care, improved outcomes, and lower cost and enhanced experience. These are the four major aspects of the major targets of any health system: quality, cost, patient experience, and workforce experience. Don't forget. Okay, these are important pillars of healthcare. Healthcare itself as a system is not a complicated industry. It's a complex industry because of the people side of it. Healthcare is a very complex pillar of your economy due to the people side, the reliance on people, and hence it looks like this. It's such a complicated or complex ecosystem. The abbreviation that you see, CAS, that's a complex adaptive system. By the way, there's a huge theory and a framework called the complex adaptive system. Healthcare is a complex adaptive system because of the different forces and stakeholders that play within this ecosystem. Look at the big players and the most important influences of healthcare system. The pushovers from government to tech to different economy sectors to accreditation bodies and standardization bodies to competition and different players to payers, which is insurance companies. And the healthcare system is like a football that is being pushed left, right, and center by all these big stakeholders. Plus new stakeholders that are coming into arena. AWS, Azure, Microsoft Azure are big players in healthcare system. Even now you can see Apple coming into the healthcare, and so on and so forth. Value-based systems are the norms in healthcare, are the trends now in healthcare. How you can build and bring all those big stakeholders to play in the same arena. How do you actually get to understand, to manage value and manage cost and deliver quality and make sure that you enhance the patient experience and safeguard your workforce? How do you actually play in a value-based system? And it requires all these players to come in. And at the bottom, you need to look at what we call the patient family engagement models or patient public involvement model. That's in the challenge is being transformed, is being enabled with the technology. The major players from payer to patient to provider, and in the yellow triangle in the middle, the government being the regulator, being the legislator, being the monitor force, the monitoring force, and the measuring force as well. They measure others. The most important outcomes in healthcare is better access, improved quality, and efficient resource allocation. And at the moment, as we go into the final slide, I want to drag your attention to the importance of the competency development, of the bringing in new skills into healthcare workforce, learning from other industries. And I think this is why we have huge gatherings. So for example, Arab Health, and this is an important gathering that happens in Dubai every year, and next year is in June. By the way, if you and Dr. Saadi actually reminded me to speak about it. As we speak today, I am in Dubai World Trade Center, the first in-person conference in Dubai after the lockdown that has happened many months ago, is GITEX, our technology week that has gathered people from all over the world for an in-person conference and also virtual events. But because of the importance of technology, GITEX Technology Week is the third biggest technology gathering in the world. Arab Health is the second biggest healthcare digital conference and exhibition in the world. And what I want to show you is, with this gathering, you are able to look at the best practices. What is happening here? What is some of the best concepts that would come in at the doorstep of your doorstep, actually. Arab Health in 2020 has landed a mouth watering, let's say, business that has been signed, right? It was a shocking figure. Over 800 million worth of secured business. Can you believe it? The amount of content that has been revealed, talking about the concepts of 5G, the concepts of big data. How many exhibitors and attendees that has come to Dubai at the beginning of this year? And this is what it's all about: innovating in healthcare. How do you skill up? How do you build your competency? How do you become disrupted with the technology in healthcare? That brings me to the last poll in my series of poll questions, which looks after, in your opinion, what are some of the enhancements areas in healthcare that we should focus on? I'd love you to give me that as I close down and I share with you my contacts. I really thank you, and I'm sorry that I've gone over the limit, but I hope you enjoyed this, and if you've learned the important objectives of this session, the importance of understanding the current state and the landscape of our healthcare system, the importance of looking at how disruption and project economy is influencing our healthcare industry by bringing in new skills, by looking at ways of implementing digital mega projects in healthcare, which is one of the most complex adaptive systems that you can come across. Very complex industry. The importance of looking at disruption and try to foresee the future within healthcare as we transform into value-based care. The concept of value, quality, patient experience. The concepts like client success management, customer success concepts that are coming into healthcare, the skill set that comes with that, data, innovation, and using the trends, the technology trends, to help us skill up and maintain this transformation journey. I think as my audience is putting together, yes, project program and portfolio management is at the heart of it. One of the most important skills, and you can see this as you go through the different healthcare organizations. The biggest and the mightiest healthcare organizations in the world, Cleveland Clinic, Mayo Clinic, they have project management and transformation at the heart of it. They have process improvement, the essence of process improvement theories and tools is at the end, using the DMAIC cycle or using the ADCAR change management platforms and frameworks, using organizational transformation frameworks. All are being brought into healthcare to drive transformation. And thank you for putting those two major enhancements at the top of your answers. Thank you, Dr. Saadi.
Thank you, Dr. Mazin. It has been really very rich, okay? I believe many of us started to do like a gap analysis in their minds between what you're doing in UAE and what other locations have. We have a long way to go. And I'm going to ask you, we don't have too many questions, just maybe 3 or 4. I'm going to ask you the first question, which is, let me, before that, just tell everybody about our next events, then we'll take the questions. So next week on December 15, which is the Tuesday, at 8 p.m. Kuwait time, we're gonna launch the relationship between advisors and our partner in Kuwait Project Management Society, with the president, Dr. Muhammad Askar. He's going to speak about the vision action plan for KPMS in 2021. Then I'm going to offer a talk about how organization leaders can survive and recover from the pandemic through focus on adaptive portfolio management and strategy implementation. So this is out of our original plan. This is additional. Then the day after, which is next Wednesday, as planned before, we have with us Dr. Rashad Baroudi. He's going to speak about performance management and KPIs. Very interesting, and I believe Dr. Mazin laid the ground a bit by speaking about KPIs tonight. And the last session we'll have is December 23rd with Louis, how to present value of PMO to executives. But we will end our year with a panel on December 30 with, I believe, 4 different organizations covering 3 continents. And we will announce this by next week. So this is what we have, still 4 activities till year end. By then we would have closed batch 2 of advisors webinars surviving the pandemic. We're gonna start later on another batch, which is a bit different. So by this, let me start the Q&A. Dr. Mazin, are you on with us?
Yes.
Yeah, okay. Okay,
yes.
Good. So my first question to you is about the overheads for management. Yani, project management or managing strategy or transformation. By themselves, they are not a discipline. It's like color. You don't see red passing by, okay? You manage a project. You don't just manage, okay? And you transform an organization, or in this case, a city or a government or culture. So there is overhead for that. And from what I've seen, what you've done is a lot of work, which is not concluded by the doctors and the nurses and the physicians themselves. This is in contrary to what we find in many places. In many places, we find the Minister of Health should be a doctor. The manager of the hospital is a doctor. Everybody is either a doctor or a nurse or a health or a physician and something like that. You don't find this marriage between management in terms of transformation, strategy, portfolio, program, project, that much in the health arena everywhere. So here I have, my question is composite of two parts. The first part speaks about what is the percentage in terms of investment that UAE puts for the management of health to make this happen, to get the KPIs, to set the strategy, to implement the strategy and whatnot. And the second part of the question, what type of competency or skills are required to succeed in this type of management?
Okay. I've noted it down. So absolutely. So let me first comment on your very good observation, Dr. Saadi. Clinical empowerment. Yes. So before 10 years ago, let's say, if you look at the health system, let's say in the UK or in the UAE, the minister or the director general of an authority might be coming from a healthcare background. At the moment, that is not necessary because the art of management is focused on the skill set rather than the background. For example, I'll give you a very good example from Saudi Arabia. Saudi Arabia had a very good number of ministers of health The most recent and the most successful is His Excellency Dr. Abdullah Rabia. He doesn't come from a healthcare background, but he comes from a computer science and was also a minister for trade and commerce, if I'm not wrong. Again, the cross-fertilization of skill set from different backgrounds into healthcare helped healthcare. Let me give you another example. In the UK, they have been empowering clinicians to the point that they've been excluding non-clinical people, and it's become a sensitivity that if you don't have any clinical background, what are you doing in the National Health Services and the NHS? And that's the thought, the culture 15 years ago. There has been a lot of revolutions in the culture of healthcare professionals that, look, there is now, you're not only a medical or a clinical professional, there's a healthcare professional. And this is a wider scope that allows for people with strategy and human capital, intelligence and skill set, people who come with finance background, people growing in his informatics and strategic pillar, and he's a huge believer in the importance of project management. So clinicians are also crossing the divide into the other skill set. Coming to your questions, what is the percentage that has been spent on the management of healthcare rather than the services? In the recent 3 years, it has been growing a lot. There's a lot of budgets that have been dedicated in strategizing in healthcare, in building and rethinking the governance of healthcare, looking at the service and operating model of healthcare. And the best example is in Vision 2030 in Saudi Arabia and Vision UAE 2021, where there's a lot of, I would say, over 75% of the expenditure has been budgeted for initiatives. I would say 70% that has been, and growing, has been focused on rethinking the way governance of healthcare is built, looking at restructuring healthcare, looking at the way health finance is managed, spending money on digitizing healthcare. How do you manage mega projects? And you can see that also in the cross-fertilization of skill set. A lot of project managers are coming from nuclear and energy industry into healthcare, from the transportation and infrastructure background. Industrial engineers are coming into healthcare. Quantum physicists, me, coming into healthcare, right? So there is a lot of that has been coming into healthcare, and there's a lot of thought leadership and different behaviors that have been generated. So there's a big percentage, and it's very evident across the region, that is being spent in managing healthcare, strategizing and implementing governance, operating models, KPIs and performance management layers and whatnot. And it's growing. This percentage is growing. Competencies and skills, there is a huge gap still. Healthcare is a complex industry. There is a lot of drive to upskill your clinicians to become a well-rounded professionals. So your physician is no longer just a clinical and a medical expert. No, they have to be a technology savvy professions. They have to be an economist. They have to be financially, viable, because they become accountable now. They have to be performance management experts, because they need to understand how KPIs are constructed, how KPIs, denominator, numerator, and what does the value mean in the whole context. So there is a huge transformation and revolution happening within clinicians and medical professionals, but because of the lack of resources, there is a lot of migration for talent from other industries to fill in the gap in the competencies and skills that we have in healthcare. So I hope that answers.
Yes, very, very interesting. Shows the importance of integrating more than one knowledge area together, specifically to succeed in complex grounds like health, especially if you have very high objectives and ambition. Now,
Absolutely.
another question from Nabil Talib. Since the change encompassed all aspects of human life and became exponential, can we say that future survival will be for smart generations only?
That's a good statement. Definitely, living in the pandemic era, ignorance is our worst enemy. Hence, education, awareness, call it smart if you like, is very important. Being digitally mature and being able to create your smart citizen concepts, as Harvard calls it, is definitely important. Building, it's the gateway for awareness. It's the gateway for building consciousness around you, because at the moment survivability in a pandemic based world is reliant on your the amount of awareness that you have. How much data are you able to see? Traceability of information, positivity, and maybe authenticity of information. How can you get access to information if you are not smart? Smart in the sense digitally mature, open, and mentally aware, and able to communicate. And I think that's the concept of smart.
Okay. Now, Muaz Gharbi is asking, based on the two famous digital platform initiatives, Google Health and Microsoft Health Vault, which failed big time, what major pitfalls should be mitigated by healthcare entities to avoid such failure? Now, I believe these are initiatives by companies, super companies, yes, but they are not initiatives by a government. So it's not similar to the typology or the way of managing health within a country.
Yes. So absolutely. So I mean, I think if the two examples that was mentioned, absolutely good examples: Google Health and Apple Health Vault. Again, I won't label it as complete failure. I label it as experiences that has been built. Because don't forget, the concepts of fail fast and learn quick is now the trend. AWS announced. Amazon announced that they started buying a pharmacy chain. They have nothing to do with pharmacy, but they are getting into the pharma business. So at the moment, there is a very nice article by PwC. It's called "The New Entrants," where there is a huge drive for acquisition from multiple industries. You could be the leader in retail, but you want to get into healthcare. You might be the leader in aviation, and you probably want to get into buy your way into healthcare. So the pitfalls, yes, pitfalls are I would say they're lessons learned. So lessons learned are, number one. One of the biggest gaps we have that would cause failures of digital transformation projects in healthcare, the lack of leadership buy-in. Very straightforward. All of the audience is used to these kind of lessons learned. Leadership buy-in. Number two, one of the major important lessons learned, you've mentioned it earlier, clinical involvement. How do we run a digital transformation project? As an IT project, or as a clinical project? So again, that's another lessons learned. By the way, the lessons that we see in the pitfalls in the mega digital transformation projects in healthcare you are familiar to it. You've seen it before in other industries. The only problem is it gets repeated. So the basics. Most of 80% of projects fail because of people. And that's the biggest headache you have in healthcare, like any other industry. Leadership buy-in, clinical staff inclusion, not enough skilled people, not enough resources, burnout. One of the biggest issues we have, not enough people, always not enough people, right? So I agree, absolutely.
On the nurse side, worldwide, we do have more doctors than we have nurses in terms of need. not in terms of numbers, okay, for example. Okay, our last question from Furqan Asrar. Many digital healthcare strategies are not business-oriented. How do you ensure the digital strategy is actually translating the business clinical side, leveraging digital technology?
It's a very good question. Very good question. So it all starts with clinical inclusion. Clinical inclusion from the very beginning, not from the midway or the last piece. They have to set, business has to be involved from the word go, from the current state assessment, from the actual, landscape analysis, you name it. And that's one of the biggest success factors in any translatable strategy. How much they get involved. Some of the strategies that I've seen in my days at PwC when I was working a few years back is you get to copy whatever has happened in the UK, or you do a benchmark and look at whatever you've done in the US. Okay, so number one, we said clinical inclusion. Healthcare scene does not become successful unless it addresses the need. It has to encompasses quick wins that will meet the expectation of the clinical, and don't forget that you do a strategy that does not serve your number one end user. And I was part of a conference in the US that talks about patient family engagement framework that you can use to design your strategy, digital transformation strategy. So digital transformation strategy could actually could reach out to your end users to be involved in putting together the initiatives, identifying the needs, putting the gap analysis, and defining the future state. So stakeholder engagement and involvement is number one success factor in a digital transformation strategy in healthcare.
Excellent, and thank you very much. It has been a pleasure. I personally learned a lot, and I'm happy we had you with us tonight. So would you like to make any final statement before we close tonight?
I would love to first thank you and thank your audience. I wish you to be safe, to be very blessed with your families. Let's pray for our frontliners across the region, across our homelands. Let's I think continue this wonderful learning journey. I really appreciate you, Dr. Saadi, and your guests who have been educating us for the last 2 and 3 months, like an amazing, amazing university. It's just us taking us back to basics, reminding us of who we are when we learn from on the hands of your great scholars. So I really appreciate you and your audience. Thank you.
Thank you, my dear. Thank you very much, and thank you, our audience, for keeping you late tonight. By this, we're gonna fall down and hope to see you safe next Tuesday at 8 p.m. Kuwait or KSA time, then Wednesday at 9 p.m. KSA time. Until then, stay safe and bye-bye.